There is nothing you could have done differently. Remember me as the smart, kind, and funny girl you knew and loved. Do something amazing in my memory, but most importantly, do not let this destroy you. Please, do not be sad because I am finally happy. I will always be with you. Rachel. That is how I signed off my first suicide note to my parents in June of 2020. When I wrote that note, I felt so lost and stuck and hopeless. And little did I know that things were gonna get much worse before they would get better. I never imagined I would live to graduate high school, let alone make it to 21. But here I am, and my progress is unfathomable. Not only am I alive, but I'm in a secure enough place where I can share my story in hopes to inspire change. I stand here before you today terrified of how people's perception of me is going to change after hearing my story. Terrified of the stigma surrounding mental illness and those who struggle with it. Terrified of sharing the hardest experiences of my life. Yet I'm here anyway because what terrifies me even more is the thought of a future where what I live through becomes the norm. The thought of kids and young adults being thrown into a mental health care system that is not equipped to help them. I am here today to share my journey with mental illness, the problems I saw from the inside, and steps we can take to change them. My story begins at 7 years old when I started getting bullied. By the age of 10, I knew it was all starting to affect me. I go to my mom, and she doesn't know what to do, so she sends me to a therapist. Between the ages of 12 and 18, I probably saw 10 to 15 therapists with no success. I then get to high school, and it was terrible. I was struggling with depression, anxiety, disordered eating, self-harm, and suicidal ideation. What got me through was the hope of going to university in America and getting a true fresh start that I so desperately needed. I get to university, and it's everything I dreamed of. I was thriving. Then COVID hit. I go home, and not only do I relapse with my mental illnesses, but I fall further into them than ever before. I began severely restricting my food intake, sleeping for more than half the day, wouldn't shower or change my clothes for weeks, was self-harming worse than ever before, and began attempting suicide. In August of 2020, I asked my parents if I can go back to school for the fall semester. Everything was online still, but a lot of my friends were going back to Atlanta just to be there together. My mom was against it, but my dad convinced her to let me try. After all, I was doing so well during my first year. I go back, and within less than a week, I attempt to overdose. A friend calls 911, I was taken to the hospital, put on a psychiatric hold, and transferred to an adult facility. While there, I had my mom contact my academic advisor to withdraw me from the semester and put me on leave. After the 3-day hold was up, my dad flew down and brought me home. Maybe 7 weeks later, I was admitted to a hospital in Toronto on their youth psychiatric unit where I spent 2 months and underwent electroconvulsive therapy, which saved my life. While in the hospital, they quickly saw I wasn't eating and diagnosed me with anorexia. Also in the hospital, the doctor referred me to be tested for autism. I got assessed, and at 20 years old, I was diagnosed as being on the autism spectrum. All of a sudden, everything made sense. It explained why I had such a hard time growing up and why treatment hadn't been working. We finally understood that all my issues stemmed from untreated autism and having to navigate survival in a brain that society is not equipped to support. November of 2021, almost a year after discharge, is when I felt the change from getting better to being better. I am in the best health I have been in since I was maybe 7 years old, and with this decided it was time to share my story. Even though I am doing so much better, I'm not cured. Mental illness doesn't really work that way. Every day is still a fight, a battle with my mind that might take years to overcome. But every day it gets a little easier to win, and it's remarkable how far I've come. In my time as a patient, I saw countless flaws in the mental health care system. The first stage I was let down was early detection. I was born with autism. I don't blame my parents, but I do believe that my school should have noticed. When I started being bullied in grade 2, it went on for months before my parents got involved. The school called them in to have a conversation with the school counselor, who essentially told them that I was the problem. I was sent for an anger management assessment that came back normal. The year went on, and I continued to be bullied. Then the next year at school, there was a new group of girls. Then I went to summer camp, and there was another group of girls. Then I switched cabins, and there was a new group of girls. Everywhere I went, people found reasons to pick on me. Looking back, it makes sense that in being autistic, these kids were able to identify something different about me that made me an easy target. However, since I was the common thread in all these issues, I was seen as the problem. My mom is very sentimental and keeps everything. So recently, I looked back at my school progress reports from these times, and they were quite concerning. In kindergarten, I was described as warm, kind, and generous. In grade 1, I was mature, eager to learn, and had developed solid friendships. However, in grade 2, I fell below grade level in socializing appropriately, respecting the rights of others, and self-control. Yet the school never thought to ask why these sudden changes had occurred. These red flags should have warranted some kind of social emotional testing that would have led to an ASD diagnosis at the age of 8. Instead, I was left with no supports, continuing to be bullied, traumatized, and taught to believe that everything was my fault. This was just the beginning. The first time I saw a therapist was around 12 years old. At this point, autism wasn't even on our radar. We were past the stage of early detection and now to start intervening with the consequences of years of emotional abuse. When I get overwhelmed, I go nonverbal and experience what is called an autistic shutdown. This often happens in therapy when I'm asked to talk about distressing memories. I would sit silently in sessions and the therapist would tell my mom that I was being difficult and not to come back until I was ready to accept help. The one that hurt the most was when I was in grade 12 and went to a psychiatrist to be put on medication. After a few silent visits, he said, "You can go to your family doctor to keep renewing your prescriptions, as there's nothing more I can do for you if you're not going to talk to me." Looking back, it makes sense these professionals couldn't help me. My depression and anxiety were rooted in autism, and traditional talk therapy wasn't going to work for me. But these were trained professionals, and none of them thought to ask why I wasn't talking beyond the fact that I was a difficult teenager. When I was 19, the struggle with early intervention presented itself again in a completely different form. In April of 2020, when I came home from school and started regressing, my parents began searching for professional support once again. However, this time the problem was access to care. No one was available. Waitlists ranged from months to over a year. We tried to get me help immediately before I had the chance to spiral, but there was nothing. So I got worse. In June of 2020, I had my first suicide attempt, which started a 5-month-long crisis. For a third time, I was failed by the system and headed to rock bottom. Now I'm critically ill and we turn to emergency resources, but have a new barrier, my age. Every time we would go to the emergency room, the psych team would clear me to go home. Not because they thought I was safe, but because there was something they could do for me. They said, "Because you're 19, you are too old for the youth unit, and we don't feel comfortable putting you on the adult unit." So I was sent home empty-handed. In September of 2020, we found a psychiatrist who agreed to take me on. She was able to find a way to get me admitted to a hospital that takes up to 20 years old on their youth unit. This hospital stay is what saved my life. When I reached rock bottom at 19, I should have died. I'm alive because my parents never gave up and tirelessly searched for options when I couldn't do anything for myself. I'm alive because my parents were able to put their lives on hold for months to watch me for 24/7 to keep me safe. I'm alive because we were able to get me the psychiatrist who found a way to get me admitted to the hospital. I'm alive because we were able to afford all of the follow-up outpatient therapy that I've needed and will continue to need for years to come. While many things in my story went wrong, everything I just listed were things that went right, things that I know a lot of people don't have access to. I can go on and on about problems I saw and challenges I faced, but I want to use the rest of my time to talk about changes we can make to improve mental health care. Step number 1 is to get mental health education into the classroom. Kids are taught about math and science, but never how to navigate their feelings and take care of their emotional well-being. Make cognitive and dialectical behavioral therapy a part of the elementary curriculum. Teach these kids skills now before they need them, so that way the first time they feel anxious or depressed, they know exactly what to do. It is so important to teach these skills early, because once you're in crisis, they're extremely difficult to learn. When you normalize conversation about mental health in kids, they grow into teenagers who aren't afraid to tell a doctor if they are struggling, the same way they wouldn't hesitate to tell a doctor if they felt a lump somewhere on their body. And if we give these kids proactive skills, they may not even need professional support once they're older. They may be able to handle situations completely on their own because they've already been taught exactly what to do. Continuing in the classroom is to better educate teachers on how to recognize mental health concerns and how to intervene. Make mental health education a component of Teachers College. Teach teachers to recognize the signs of autism, ADHD, abuse, trauma, and more. As kids get older, the warning signs change. So middle and high school teachers have to be trained in these as well. They need to understand that the typical red flags may not always be there. High-functioning mental illness is becoming more and more common, but turns debilitating when gone untreated. While teachers can play a critical role in detection, it's ultimately the professionals who need to treat these kids. In my experiences, mental health professionals tend to take a very narrow point of view when treating mental illness. They look at the symptoms without exploring the underlying cause. This approach will often fail because if you only treat the symptoms without treating the cause, the symptoms will almost always return. When you only treat the symptoms, what happens is that the next time life gets hard, and trust me, it will, you revert to your negative coping mechanisms, your illness screams at you, and it becomes harder and harder to fight off each time. We need to change the way we approach mental health care by taking a holistic approach. Look at the patient as a whole. Mental illness is rarely in isolation. They are buy one, get five free, and they are all intertwined. Don't wait for the symptoms to worsen. Don't wait for everything to become so complex. And that leads me to my next point. Don't wait. Ontario is seeing the largest demand for mental health care services it ever has. While it is devastating to think that this many people are struggling, it is incredible that this many people are reaching out for help. We as a society are moving away from the stigma surrounding receiving mental health care. People are gathering the courage to ask for help, but there's nothing. They are told to wait, and while they wait, they get worse, becoming more complex patients that require different care that has a list of their own. An analogy I like to give is to compare mental health treatment to cancer treatment. If a patient is diagnosed with stage 1 cancer, the doctor will say, how lucky we are to have caught it early. We will start treatment right away, and you have a great shot at beating this. They would never say, come back in a year when it's stage 4, we'll start treatment then and hope for the best. But mental health care is exactly the latter. It's, you're not sick enough, you're not critical, you're being dramatic. Come back when you're dying, and maybe then we'll try to help you. When you make mental health care patients wait, the system is digging itself further into a hole. And I know that we all know the answer to this is more resources, which is a lot more complicated than it sounds. But I also know that we all know this is exactly what we need. We need more doctors. We need more public and affordable mental health care services. Mental health in Canada is underfunded. That is no secret. That needs to change. In addition to increasing resources, we also need to consider what kind of resources we are investing in. From my experience, we saw that you can either be treated in the hospital or outpatient by seeing a therapist once or twice a week. There were very few options for care in between. We need different levels of care to meet patients where their needs are. We need day programs and residential programs because sometimes once a week therapy isn't enough, and we don't want to wait for these patients to get to the point where they need the hospital. Something beneficial about these programs as well is that they create community. Speaking from personal experiences, I can tell you how impactful peer support is when undergoing treatment, especially from those at the same age. In telling my story, I mentioned how my age became a major barrier in my treatment. 18 to 25-year-olds get lost in the system. In this age group, mental illness is the most prevalent, but also the most underserved. This age group is so unique in terms of life events and neurological development that happens, creating the perfect storm for mental illness to arise. In this age, the prefrontal cortex is the part of the brain that's developing the most. This part of the brain is responsible for decision-making, impulse control, and social behavior. Without these regions being fully developed, it makes sense that kids in this age group will have a hard time making rational decisions, adjusting to university or independent life, and just not breaking under the pressure of societal demands. What we are seeing is that kids are also starting to struggle earlier and earlier and need help younger and younger. While limited resources make it hard for younger kids to find help as well, often when they turn 18, they have to restart. Some providers continue seeing their patients into legal adulthood, but many don't. And when I say legal adulthood, I mean past 18. Because even though this is what the government defines as an adult, science tells us we're not adults until we're 25. It can be a huge setback for patients to have to restart with a new treatment team when receiving mental health treatment. The solution to the gap in this transitional age group is adolescent medicine. The definition of adolescence is very controversial. You can find sources saying it goes anywhere, it ends anywhere between 17 and 25. In my opinion, in the scope of mental health, adolescence ends at 25. We need to come to a consensus on what adolescence is and then build a field of adolescent medicine. We need doctors who specialize in the uniqueness of 18 to 25-year-olds that best understand their lives and brains in order to treat them properly. We need doctors who are able to continue to see their patients into their early 20s. We need inpatient psychiatric units and outpatient programs specifically for 18 to 25-year-olds because these patients deserve help too. I know it's really easy for me to stand here and give all these suggestions, but really hard to actually make them change. To the policymakers and healthcare professionals out there, I'm not asking you to make these changes overnight. What I am asking is for you to listen. For you to look at the data that tells us that we need to invest in mental health care, especially given the unknown implications of COVID-19. For you to take my suggestions and seriously consider them. For you to give mental health professionals and mental illness survivors a seat at the table when deciding how to allocate funds. We need things to change. Our lives depend on it. And for the kids and adults out there who are struggling, I'm so sorry. I'm sorry you hurt as you do, and I'm sorry it is so hard to get help. But I want you to look me in the eye when I tell you that I see you, I hear you, I was you. It is really hard, but things can get better. And I want you to know that there are people on the other side doing everything they can so it doesn't have to be this hard forever. Personally, I've created a platform on Instagram called 25 Alive that I hope to grow into a national advocacy organization. I might have fallen through the cracks, but I climbed back up. And now we can work together to fill those cracks to ensure more kids don't fall through again. We have our work cut out for us. We are ready to talk about mental health.